Third part subclavian artery block. Third part subclavian artery runs on superior surface of first rib. Therefore, third part of subclavian artery can be compressed on superior surface of first rib in case there is any bleeding going on distally. The thumb to compress the third part of subclavian artery should be placed lateral to the sternocleidomastoid and scalenus anterior muscle and the interscalene triangle anteriorly, scalenus anterior muscle posteriorly, scalenus medius muscle. Important information: brachial plexus can also be blocked in interscalene triangle. Left subclavian artery syndrome, Steele syndrome. Severe stenosis or occlusion of subclavian artery on one side can lead to ipsilateral upper limb ischemia. To avoid this, the contralateral vertebral artery arising from first part of subclavian artery starts to pump the blood into ipsilateral vertebral artery. Therefore, blood is not pumped into the basilar artery. Hence, there is a reversal of blood flow in ipsilateral vertebral artery. This causes the blood to flow into ipsilateral subclavian artery. This prevents ischemia of ipsilateral upper limb. Severe stenosis or occlusion of subclavian artery on one side can lead to ipsilateral upper limb ischemia. To avoid this, the contralateral vertebral artery starts to pump blood into ipsilateral vertebral artery. Therefore, blood is not pumped into basilar artery. Hence, there is reversal of blood in ipsilateral vertebral artery. This causes the blood to flow into ipsilateral subclavian artery. This prevents ischemia of ipsilateral upper limb. This is called subclavian Steele syndrome because subclavian artery is stealing blood from circle of Willis so that upper limb can be supplied with blood. Therefore, in this case, both the vertebral arteries are supplying the upper limb. Stenosis in left subclavian artery. Circle of Willis in this case is being supplied by internal carotid artery. Advise the patient to avoid any heavy manual work on affected site. To avoid severe brain ischemia, subclavian Steele syndrome has grade 1, 2, 3. In grade 3 of subclavian Steele syndrome, severe ischemia of circle of Willis joint. In grade 3 of subclavian Steele syndrome, severe ischemia of circle of Willis joint. External carotid artery. 8 branches of external carotid artery. 3 anterior, 2 posterior, 2 terminal, 1 medial. 2 terminal branches of external carotid artery. Superficial temporal artery. It supplies the temporal region. Maxillary artery. It supplies the maxilla. It has 3 parts. Maxillary artery has 3 parts. Branches of first part of maxillary artery. Inferior alveolar artery. It supplies the lower teeth. Middle meningeal artery. It passes through the foramen spinosum to reach under the pterion. It can bleed and can cause an extradural hemorrhage due to some skull fracture. Branches of third part of maxillary artery. Superior alveolar artery. It supplies the upper teeth. Palatine artery. They supply the palate and the little area of epistaxis. Maxillary artery has 3 parts. Branches of first part of maxillary artery. Inferior alveolar artery. It supplies lower teeth. Middle meningeal artery. It passes through foramen spinosum to reach under the pterion. It can bleed and can cause extradural hemorrhage due to some skull fracture. Branch of third part of maxillary artery. Superior alveolar artery. It supplies upper teeth. Palatine artery. They supply palate and the little area of epistaxis. 3 anterior branches of ECA. Superior thyroid artery. It supplies the thyroid gland. Lingual artery. It supplies the tongue. Facial artery. It supplies the face. Facial artery can be felt at anterior border of masseter muscle at mandible bone. Superior labial artery supplies the upper lip and also contributes